Let me ask you something, and I want you to think about this seriously. What if your heart was aging faster than the rest of your body, and you had absolutely no idea? Not because you felt sick, not because your doctor told you something was wrong, but because the signs, the real warning signs, are so quiet, so easy to dismiss, so easy to blame on just getting older, that most people completely ignore them. And here's the part that surprises even my own patients. These warning signs don't always feel like chest pain. They don't always look like a heart attack waiting to happen. Some of them feel like tiredness. Some of them feel like needing to use the bathroom at night. Some of them feel like getting winded walking up the stairs to your bedroom. And every single day, people over the age of 60 chalk these things up to aging, when in reality, their heart is waving a red flag trying to get their attention. I've been a cardiologist for over 2 decades. I have sat across from thousands of patients, and I can tell you, the people who catch these signs early, they change their outcomes dramatically. The ones who wait, well, by the time they come to me, we're playing catch up. So today, whether you're 60, 70, 80, or beyond, I want you to pay very close attention, because what I'm about to share with you could genuinely change your life. Hello everyone, I'm Dr. Alex Varsakis. I'm a board-certified cardiologist, and if you're new to this channel, welcome. My entire mission here is simple. I want to help people over the age of 60 live longer, healthier, and more independent lives. I want you to feel strong. I want you to enjoy your grandchildren. I want you to wake up every morning with energy and purpose. And the best way I know how to help you do that is to give you real, honest, science-backed information in plain language, the way I'd talk to you if you were sitting right across from me in my office. In today's video, I'm going to walk you through the 5 warning signs that your heart may be aging faster than it should. We're going to talk about what each one means, why it happens, and most importantly, what you can actually do about it. Before we dive in, I want to share an important reminder. The information in this video is for educational purposes only and is not a substitute for medical advice from your own healthcare provider. If you have concerns about your heart health, please see your doctor. Now, let's get into it. Before I give you the 5 warning signs, I want you to understand something important, because this context is going to make everything else make sense. Your heart is a muscle. And like every muscle in your body, it changes with age. After the age of 60, the walls of your heart begin to thicken slightly. The arteries become stiffer. The electrical system that controls your heartbeat becomes a little less precise. The valves that open and close with every beat start to show wear. These are normal biological processes. They happen to everyone. But here is what separates a heart that is aging gracefully from one that is aging dangerously fast. Inflammation, inactivity, blood sugar dysregulation, high blood pressure, and chronic stress. These 5 accelerators, when left unchecked, can age your heart by 10, 15, even 20 years beyond your actual age. And the frustrating part is, none of them hurt. None of them announce themselves. They work quietly, in the background, day after day. That's exactly why I want to teach you these warning signs, because when you know what to look for, you have power. And power in medicine means early intervention, which almost always means better outcomes. Ready? Let's go through all 5. Number 1, you get winded doing things that never used to bother you. I want you to think back 5 years, maybe 10 years. Could you walk up a flight of stairs without stopping? Could you carry your groceries from the car to the kitchen without needing to catch your breath? Could you walk around the block with your grandkids without feeling like you needed to sit down? Now think about today. If your honest answer is, those things feel harder now, and especially if that change happened gradually, not all at once, I want you to pay attention to this sign. In cardiology, we call this decreased exercise tolerance, and it is one of the earliest and most reliable signs that the heart is struggling to keep up with the demands being placed on it. Here's what's happening physiologically. When your heart ages too fast, particularly when the left ventricle becomes stiff, It has a harder time filling with blood between beats. This condition is called diastolic dysfunction, and it's incredibly common in adults. When your heart can't fill properly, it can't push enough blood forward with each pump. Your muscles and organs don't get the oxygen-rich blood they need. So your body's response is to breathe faster and work harder to compensate, which is why you feel short of breath. Why this matters after 60. Studies published in cardiology journals have found that adults over 65 with diastolic dysfunction have a significantly higher risk of heart failure, even when their overall heart function appears normal on a basic test. The real-life example. One of my patients, a retired teacher in her late 60s, came to me complaining about needing to stop halfway up her staircase at home. She'd lived in that house for 30 years. She assumed it was just her knees. After an echocardiogram, we found early diastolic dysfunction and elevated blood pressure that she hadn't known about. We caught it, we treated it. Today, 2 years later, she walks 2 miles every morning. Your action step. If you notice a meaningful change in your ability to do activities you've always done, especially if it's been happening slowly over months or years, please bring this up at your next doctor's appointment and specifically ask for a cardiac evaluation. Don't assume it's just your joints, your weight, or your age. Your heart deserves to be ruled out. Stay with me, because warning sign number 2 is one that almost everyone brushes off as not a big deal, but cardiologists consider it a serious red flag. Warning sign number 2. Your ankles or feet swell by the end of the day. Take a look at your ankles right now, or think about how they look in the evening. Do they look puffy? Do you press your finger into the skin above your ankle bone and notice it leaves a little dent that takes a few seconds to spring back? Have you noticed that shoes that used to fit comfortably now feel tight by afternoon? This is called pitting edema, and while it has many causes, when it appears consistently in the lower legs and feet of someone over 60, the heart always needs to be considered. Here's the science behind why this happens. Your heart pumps blood out to your body, and your veins are supposed to carry it back. When the heart becomes weakened or stiff, particularly the right side of the heart, it doesn't move blood through the circulatory system efficiently. Pressure backs up in the veins. Fluid is pushed out of the blood vessels and into the surrounding tissue. It pools at the lowest point of your body, your feet, your ankles, your lower legs, because of gravity. This can be a sign of early heart failure, a condition that affects millions of Americans over 65, many of whom don't even know they have it. Now, I want to be very clear. Swollen ankles are not always heart failure. Medications like calcium channel blockers or certain blood pressure drugs can cause ankle swelling. So can kidney disease, venous insufficiency, or simply sitting too long without moving. But here's the key question. Has the swelling gotten worse over time? Does it go away at night when you lie down and come back during the day? That pattern, swelling that improves with elevation, is a classic hallmark of fluid backup from the heart. Why this matters after 60. After age 65, the risk of heart failure climbs steeply, and early heart failure is very treatable when caught in its early stages. Left unaddressed, it can progress to a point where simple tasks like walking to the kitchen become exhausting. Action step. Tell your doctor exactly when the swelling happens, how long you've noticed it, which medications you take, and whether it goes away at night. Ask specifically, could this be related to my heart? A simple physical exam combined with a BNP blood test and an echocardiogram can give you a very clear picture. Coming up is warning sign number 3, and this one is particularly surprising. It happens at night while you're trying to sleep, and most people have never connected it to their heart. Warning sign number 3. You wake up at night to urinate more than twice, or you feel restless and uncomfortable lying flat. This one surprises nearly every patient I share it with. You probably think of nocturia, that's the medical term for waking up to urinate at night, as a prostate issue if you're a man, or simply a bladder issue if you're a woman. And sometimes it is. But here's what most people don't know. Frequent nighttime urination, especially if it's gotten significantly worse in the past year or two, can be an early cardiac warning sign. Here's why. When you stand or sit during the day, gravity pulls fluid down into your legs and lower body. But when you lie down to sleep, that fluid redistributes. It gets reabsorbed into your bloodstream. your heart has to process that extra fluid volume. If your heart isn't as efficient as it should be, your kidneys step in to help. They start filtering out the extra fluid load. Result? You're up at 2 a.m., 3 a.m., 4 a.m. Additionally, and this is the even more important part for people over 70, if you find that you can't lie flat comfortably at night, if you find yourself propping yourself up on 2 or 3 pillows, or if you wake up in the middle of the night feeling short of breath, these symptoms have specific names in cardiology. We call them orthopnea and paroxysmal nocturnal dyspnea, and they are classic signs of heart failure. Fluid that accumulates in your legs during the day shifts to your lungs when you lie down. A weakened heart can't clear that fluid properly, so you wake up breathless, sometimes feeling like you're drowning. Patients often describe it as a frightening sensation. They need to sit up or get to a window to feel better. Why this matters after 60. Sleep disruption from cardiac causes is one of the most under-recognized problems in older adults. It is frequently blamed on the prostate, on caffeine, on stress, on anxiety. Meanwhile, the heart goes unexamined. Action step. Keep a quick sleep log for 1 week. Note how many times you get up at night, and whether you ever wake up short of breath. Write down how many pillows you need to sleep comfortably. Bring that information to your doctor. This is the exact kind of detail that gives your cardiologist important clues. Don't go anywhere. Warning sign number 4 is one of the most overlooked cardiac signs in women over 60, and it can present in ways that have nothing to do with your chest. Warning sign number 4. Unexplained fatigue that doesn't get better with rest. We live in a culture that tells older adults to expect to feel tired. You're not 40 anymore. Of course you're tired. You've had a busy life. Take a nap and you'll be fine. But there is a very important difference between normal aging fatigue, the kind that comes from physical activity, poor sleep, or a busy week, and cardiac fatigue. And learning that difference could change everything. Cardiac fatigue is fatigue that doesn't make sense. It's waking up after 8 hours of sleep and still feeling exhausted. It's sitting in a chair all morning and feeling completely drained by noon, without having done anything physical. It's a bone-deep tiredness that rest doesn't seem to touch. This happens because when the heart isn't pumping efficiently, the body doesn't get the oxygen and nutrient delivery it needs at the cellular level. Your muscles, your brain, your organs, they all run on oxygen. When circulation is compromised, they run slow. You feel it as a profound, persistent tiredness. This is particularly important for women over 60. Research has repeatedly shown that women are more likely to experience atypical heart attack symptoms, meaning symptoms that don't include dramatic chest pain. Instead, women more often report extreme, unexplained fatigue, sometimes for days or weeks before a cardiac event. In fact, one landmark study found that over 70% of women who experienced heart attacks reported unusual fatigue in the month before, and most of them didn't connect it to their heart at all. Real-life example. A patient of mine, a 72-year-old retired nurse, someone who knew medicine well, came to me after weeks of what she described as just feeling off. She wasn't in pain, she wasn't breathless, she was just exhausted in a way she couldn't explain. We ran a workup. She had significant coronary artery disease. We caught it before a major event. She told me afterward, "I almost didn't come in because I thought I was just getting old." That sentence haunts me, because that is exactly what this warning sign sounds like. Just getting old. Action step. If you've been experiencing persistent fatigue that isn't explained by your activity level, your sleep, or a known health condition, please don't dismiss it. Bring it up specifically. Tell your doctor, I'm experiencing fatigue that doesn't go away with rest, and I want to make sure my heart has been evaluated. Ask for an EKG. Ask for basic cardiac blood work, troponin, BNP, CBC, metabolic panel. Ask whether a stress test is appropriate for you. Warning sign number 5 is one that people often notice but rarely mention to their doctor because they feel embarrassed or they think it's too vague to bring up. But in cardiology, it is one of the signs we take most seriously. Warning sign number 5. Heart palpitations, irregular heartbeats, or a fluttering sensation in your chest. Nearly every adult over 60 has experienced this at some point. A flutter in your chest. A sensation like your heart skipped a beat. A brief pounding that comes out of nowhere and then disappears. Or a feeling that your heart is racing, even when you're sitting still and perfectly calm. Some people describe it as a flip-flop. Some say it feels like a fish flopping in their chest. Some notice it when they lie down at night. Some notice it after eating a big meal. And most people, they don't mention it to their doctor. Because it goes away. Because it seems random. Because they're worried they'll be told they're overreacting. Here is what I want you to understand. Occasional, brief palpitations in an otherwise healthy person are almost always benign. They're called premature beats, PACs or PVCs, depending on which chamber they come from, and they become more common with age. A little caffeine, stress, alcohol, or dehydration can trigger them. But here is when palpitations become a serious cardiac warning sign. When they are frequent. When they last more than a few seconds. When they come with dizziness, lightheadedness, or shortness of breath. And especially when they feel like a fast, chaotic, irregular rhythm. That last description is the hallmark of atrial fibrillation, AFib. And this is what I want you to understand about AFib. Atrial fibrillation is the most common heart arrhythmia in adults over 60. It affects over 5 million Americans, and that number climbs with every decade of life. In AFib, the upper chambers of the heart quiver instead of beat, and that disorganized electrical activity means blood can pool and clot in the heart. Those clots can then travel to the brain. A fib is one of the leading causes of stroke in older adults. It increases stroke risk by up to 5 times. And the tragic part is, many people with AFib don't know they have it. It can be completely silent, or it can feel like random, brief palpitations that come and go. Why this matters after 60? The older you are, the more at risk you are for AFib, and the more devastating a stroke becomes. Early detection of AFib, followed by appropriate blood thinning therapy and heart rate control, dramatically reduces stroke risk. Action step. Tell your doctor every time you notice something unusual with your heartbeat, even if it lasted only 5 seconds and disappeared. Ask your doctor about an EKG and a Holter monitor, a small wearable heart monitor you wear for 24 to 48 hours. If you own a smartwatch or wearable that tracks heart rhythm, use the AFib detection feature and share those readings with your doctor. And here is something practical you can do right now at home today. Sit quietly. Place 2 fingers on the inside of your wrist, just below your thumb. Feel your pulse. Is it steady and rhythmic? Or does it feel irregular? Sometimes fast, sometimes slow, sometimes skipping around. An irregular pulse at rest is worth bringing to your doctor's attention immediately. Section 4. Common mistakes seniors make that accelerate heart aging. Now I want to talk about something very important, because knowing the warning signs is powerful. But understanding what's driving that accelerated aging in the first place, that's where you truly get your power back. Here are the 5 most common mistakes I see seniors make that quietly age their hearts at double the normal speed. Mistake number 1, relying on how you feel to judge your heart health. Your heart can be in serious trouble without you feeling a thing. High blood pressure, which I call the silent killer, affects roughly 70% of adults over 65. It damages arteries, overworks the heart, and causes the heart muscle to thicken and stiffen. And most people with high blood pressure feel completely normal. The action step is simple. Know your numbers. Blood pressure should be checked regularly. Know what your reading is, not just whether it's fine, but the actual number. If it's consistently above 130/80, have a real conversation with your doctor about management. Mistake number 2, stopping exercise because of aches, pains, or fear. I understand this deeply. As we age, joints hurt. Knees ache. We've heard stories of people having heart attacks during exercise. And so we slow down. We sit more. We move less. But here's the cardiac reality. Physical inactivity is one of the most powerful accelerators of heart aging that exists. A sedentary lifestyle raises blood pressure, raises blood sugar, promotes inflammation, stiffens arteries, and weakens the heart muscle itself. You do not need to run marathons to protect your heart. Walking 20 to 30 minutes a day, 5 days a week, has been shown in large studies to significantly reduce cardiovascular mortality. Chair exercises, gentle resistance training, swimming, all of these count. Movement is medicine. And the heart specifically responds to regular aerobic activity by becoming more efficient and more resilient. Mistake number 3, ignoring sleep problems. We talked earlier about waking up at night and feeling restless lying flat, but I want to go a step further here. Obstructive sleep apnea, a condition where breathing stops and starts repeatedly during sleep, is another major, under-recognized heart ager. It affects an enormous percentage of adults over 60, particularly those who snore loudly, who wake up tired despite sleeping enough hours, or who have been told by a partner that they stop breathing at night. Sleep apnea causes repetitive drops in oxygen levels throughout the night. Each episode spikes blood pressure and stresses the heart. Over years, this causes hypertension, arrhythmias, and heart failure. Treating sleep apnea with a CPAP machine has been shown to reduce blood pressure, improve heart function, and reduce cardiovascular risk. If you snore, if you wake up exhausted, if your partner has noticed your breathing stops at night, ask your doctor about a sleep study. It could be one of the most important tests you ever have done. Mistake number 4, underestimating the impact of blood sugar on heart health. This connection is not talked about enough. Elevated blood sugar, even in the pre-diabetic range, long before a formal diabetes diagnosis, accelerates damage to arteries and the heart. Chronically elevated glucose promotes inflammation, damages the lining of blood vessels, and leads to the buildup of arterial plaque. Adults with type 2 diabetes have 2 to 4 times the cardiovascular risk of those without it. And the process of arterial damage begins years, sometimes over a decade, before blood sugar reaches the diabetic threshold. Action step. Ask your doctor for a fasting blood glucose and an HbA1c test. These two numbers paint a clear picture of where your blood sugar control stands. If your HbA1c is above 5.7%, you're in the pre-diabetic range, and there is a tremendous amount you can do through diet, exercise, and weight management to reverse that trend. Mistake number 5, dismissing stress as just part of life. Chronic psychological stress has a direct, measurable impact on cardiovascular health. When you're under chronic stress, your body releases cortisol and adrenaline continuously. These hormones raise blood pressure, raise blood sugar, promote inflammation, cause arterial stiffness, and drive behavior patterns like poor sleep, emotional eating, and inactivity that further accelerate heart aging. Research has consistently shown that chronic stress is an independent risk factor for heart attack and stroke, even when other risk factors are controlled for. Managing stress is not a luxury. It is a cardiac health intervention. Whether that means daily walks in nature, meditation, prayer, social connection, deep breathing exercises, gardening, music, find what lowers your stress response, and do it deliberately, consistently, as part of your heart health plan. Section 5, your heart health action plan, steps you can start today. Let me give you something practical to walk away with, a simple, clear, doable action plan. Step 1. Know your 4 core numbers. Blood pressure, target below 130/80. Fasting blood glucose, target below 100. HbA1c, target below 5.7%. Total cholesterol with LDL breakdown, discuss target with your doctor. If you don't know all 4 of these right now, that's your first homework assignment. Call your doctor's office this week and ask for a lab order if you're due for blood work. Step 2. Move your body every single day, even a little. 20 to 30 minutes of walking most days is the single most evidence-backed thing you can do for your heart after age 60. If walking is difficult because of joints or balance, consider a stationary bike, chair exercises, water aerobics, or resistance bands. The heart does not care how you move. It just needs you to move. Step 3. Eat for your arteries. Focus on reducing sodium. Aim for under 1,500 to 2,000 milligrams per day if you have high blood pressure. Increasing potassium-rich foods like bananas, avocados, and leafy greens, reducing ultra-processed foods and added sugars, and eating more omega-3 rich fish like salmon, sardines, and mackerel at least twice a week. Step 4. Have a real conversation with your doctor about your heart. Don't wait for your doctor to bring it up. At your next appointment, specifically say, I want to talk about my cardiovascular risk. Can we review my EKG, my blood pressure history, my lipid panel, and discuss whether any further cardiac testing is right for me? Being direct and specific gets you better care. Step 5. Address sleep. Prioritize 7 to 8 hours. If you snore, ask about a sleep study. If you have trouble falling or staying asleep, discuss this with your doctor. Poor sleep has direct cardiac consequences, and there are effective interventions. Step 6. Take stress seriously. Build one dedicated stress reduction practice into your daily routine. It doesn't have to be complicated. 10 minutes of deep breathing in the morning, a daily walk in nature, a regular phone call with someone you love. These things measurably reduce cortisol and support cardiovascular health. We've covered a lot today, and I want to take a moment to bring it all together. The 5 warning signs your heart may be aging too fast. Number 1. Getting winded doing things that didn't used to bother you. This could signal your heart is struggling to fill and pump efficiently. Number 2. Swollen ankles or feet by the end of the day. This can indicate fluid backup from the heart and should always be evaluated. Number 3. Waking up frequently at night to urinate or being unable to sleep flat comfortably. These can be cardiac symptoms, not just plumbing issues. Number 4. Unexplained fatigue that doesn't improve with rest. Especially in women, this can be a critical cardiac warning sign. Number 5. Palpitations, irregular heartbeats, or fluttering sensations. Particularly if frequent or accompanied by dizziness, this could be AFib, which requires prompt evaluation and treatment. Here's what I want you to hold on to as you close this video today. Your heart is not a passive victim of time. It responds to what you do. It responds to movement, to nutrition, to stress management, to sleep, to medical attention. The people who change their outcomes are not people who stumbled onto some secret. They're people who paid attention, took action, and didn't wait until something went terribly wrong to start caring about their heart. You are not too old. It is not too late. Every step you take, literally and figuratively, is a vote for a longer, stronger, more vibrant life. I believe in your ability to do this, and I will be here every week to give you the best information I know how to share. Before you go, I have a quick favor to ask. If this video gave you something valuable today, a new piece of information, a question to bring to your doctor, a sense of reassurance that you're paying attention to the right things, please hit the like button. It takes 1 second, and it helps this channel reach more people over 60 who need this information. If you aren't subscribed yet, please subscribe and hit the bell so you never miss a new video. I post new content every week specifically for you. And please, share this video with someone you care about. Share it with a friend, a sibling, a parent, a neighbor. Because the warning signs I covered today are exactly the kinds of things that slip through the cracks. Your share could genuinely change someone's life. Finally, leave me a comment. Tell me where you're watching from, and tell me what health topic you'd most like me to cover next. I read every comment, and your suggestions directly shape what I create next. Thank you for being here. Take care of your heart, because it has been taking care of you your entire life. I'm Dr. Alex Varsakis, and I'll see you in the next video.